Okay, so this is called cervical disinhibition. And so this is for waking up the neck stabilizers, deep stabilizers, okay? So don't have too much support underneath your head, just some light support so that you feel rather comfortable here is good. I don't want you essentially head starting here. I don't want head starting into any sort of extension pattern there either. So try to have that just enough support to kind of get your head in a bit of a neutral position here. So some basic keys to this is that kind of imagining a grapefruit between your chin and your chest. You're not squishing the grapefruit, okay? Because I don't want to see this chest pop up and I don't want to see the head drop down like this, okay? I just want, if anything, I want that chest to stay down, okay? Chest stays down and then you're bringing your chin slightly down to the chest, okay? Small movements are imperative here. So as you drop that the chin down, you're gonna find space, you're gonna create space in the back of the neck here, okay? And so keeping that there, keep the tongue on the roof of the mouth as you do this. You're going to imagine doing a light drawing of your vertebra down into the table, okay? So that's why we have the resistance band, to give you some idea of where your force needs to be. Now again, this is low and slow is the key here, small movements, okay? I don't want yanking, okay? Because that's gonna get your large muscle groups engaging and that's not really what we're looking for here. They're probably doing too much work anyways. We're trying to get those lower, slower stabilizers to engage. So you're just giving yourself enough feedback towards the ceiling to think about where that resistance band is meeting that vertebra in the back. So you're trying to keep that chest down, drop the chin a little bit, squeeze that grapefruit, tongue on the roof of the mouth, and apply pressure in the reverse direction from this resistance band. So right where this band is, I am trying to apply pressure downwards, okay? Here. Okay, so you're gonna hold for a few seconds. Good, you can do a little bit of a tug to make sure you feel pretty sturdy there, okay? You can hold for 10 seconds or so, and then you can relax, you can move this up a notch, because you should get at least 4 scoots with this, if not between 4 and 7 scoots. So now I'm tongue on the roof of the mouth, chin drops, chest drops, resisting through the hands and resisting in the opposite direction with the neck. Okay, 10-second holds or so, and then you can move up another notch. Okay, so key factors again are too hard, too fast, too much force, but then also don't jam your head back to get this to engage, because you see as I jam my head back, my neck actually comes forward. So I'm not trying to, I don't want to do this to get this to resist this, okay? And I don't really want to use a whole bunch of my upper back to resist it either. Try to make it very specific, because these are those stabilizers that we're looking for. All right, so you can go through that at least once, and then I'd rather you do it multiple times a day, so up to 4 or 5 times a day, okay? You can consider that same concept, tongue on the roof of the mouth, and grapefruit with that slight elongation through the neck in a sitting position as well, but really focus on this at least 4 times a day with those 10-second holds 4 times or so, between 7 and 4 times up the neck, okay? All right, knees bent as well, please, and good luck.